Hello, my name is Jochen Tunkel and I'm a periodontist and oral surgeon in Bad Oeynhausen in Germany. First of all, we did a lot to get the personal protective equipment, ordered face masks and the staff was obliged to wear them all day. We ordered KN95 masks and also protection shields for the faces. And after introducing all these, there's a reduced risk for our staff, and that means a reduced risk for the patient to get an infection. We hung up signs at the entrance. First of all, to ask the patient screening questions, whether they might be infected and so not entering our practice. And for example, to use disinfection at the entrance. And another thing was that a sign which showed them to keep the distance and therefore protecting other patients and our staff as well. We stopped shaking hands. Of course, I think everyone did that. Another thing is we asked patients not to bring accompanying people with them, avoiding crowds again. At the reception, we installed lines on the floor, showing the zones not to be entered and where to stand and to keep the distance from our staff and from other patients. In the waiting room, we removed all magazines and information flyers to make it more easy and feasible to clean the room, but also that not information flyers are touched by many people and so disease is transmitted via that way. We had a look that not that many patients are getting crowded in the waiting room. For that, for example, usually I see 3 patients in 15 minutes during suture removals, and I reduced this to 2 patients. And especially in the orthodontic part, we reduced patients not to get crowded in the waiting room. Appointments, a little less appointments in our office. We, for example, I always think, when do I have to see the patient the next time for control after surgery? And if there's not a complication or I don't expect a complication to come, I see the patients only after 14 days. Usually I see them after 7 days.